Good morning, everyone, and welcome to the House Committee on Health and Human Services and Elderly Affairs. We have a public hearing this morning on an amendment on House Bill 619. Before we get to that, though, I'd ask you to please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Again, we are here today to consider an amendment or hear testimony on an amendment from all of you on House Bill 619. It is amendment number 2023-2359H. It is our custom in this committee and has been our practice for this past year to allow the prime sponsor extra time because they're giving the background and the genesis of the bill. Representative Leon, I'd ask her to come forward at this time. She is the prime sponsor. She has agreed to abide by the same 3-minute rule that all individuals will be asked to abide by. And we do have a 3-minute rule on testimony, mainly because we want to ensure that everybody has an equal chance to participate and offer their input. Representative Weber.
Thank you, Mr. Chairman. I have a point of order, which is that having looked very carefully at the side-by-side, there are modifications to the original bill, but there is no added content that is different from the subject matter of the original bill. And therefore, I fail to understand how this is a non-germane amendment. It is my understanding that the Speaker has, however, ruled that it is a non-germane amendment. So we are where we are because he is the Speaker and I am not. But I just want it to be clear that I think that this hearing is simply a second rehearing of a hearing we've already had. And I thank you very much for your indulgence in letting me say so.
Certainly. Thank you for that comment, Representative Weber. Both the Speaker and the Clerk have been consulted on this matter, and they both are in agreement that this hearing was necessary. So accordingly, we are here. Representative Leas.
If I may make one correction, the Clerk assures me that the Speaker ruled that it was a non-germane amendment.
Okay. Okay. Thank you. Okay. Representative Leon.
Good morning, Mr. Chairman, members of the committee, and members of the public. For the record, my name is Erica Leon, and I represent the town of Derry. I want to start off by speaking to the transgender community and those who love them. This amendment and the bill that it replaces do not seek to erase you. We do not seek to invalidate your experience. This effort is to prioritize your lifelong health and well-being by pumping the brakes on the rapid adoption of this medical care for your age group. We know that you were focused on your personal struggles and on finding an immediate solution. I get that, but as somebody who worked with medical innovation for almost 2 decades, I know that it's also important to make sure that there are data and people like you. And by like you, I mean your age and your prior medical history, before getting too excited that some surgery will in fact change your life for the better without unexpected side effects. For over a decade.
Representative, excuse me.
I'm sorry, I have one more point of order, which is I don't believe that signs are allowed in the committee rooms.
They're not. I'm sorry. Yeah, you're going to have to leave it, put that down.
If it's put down, I don't have.
Okay. Yeah, thank you. Sorry.
Thank you.
Resume, Representative Leon.
For over a decade, I worked to find money to drive research into new medical technologies and expand them to new markets. I saw the successes, and I also saw the body count of the failures. I saw how one failed medical intervention can cascade into a lifetime of poor health and reduced quality of life. And my experience was usually with people much older than teenagers, usually on the opposite end of the age spectrum. The amendment we're discussing today replaces the entire original bill. That means the school section is out entirely, as is discussion of puberty blockers, cross-sex hormones, and surgeries such as mastectomy. Today, we're here to talk about two things. First is, should the state of New Hampshire allow bottom surgeries in people under 18? Some ask if these surgeries are done in New Hampshire. Hopefully there's people behind me that can give us solid, conclusive data. However, we do know that at Boston Children's Hospital, vaginoplasties are done in those who are 17 and older. In a WorldPath study, a survey in 2017 of 20 centers in the US that provide this care, half of them provided genital surgeries to minors. So this is something that is happening. The question is this something that we should be doing in this state, or should we allow the science to proceed without us, with those who really need to seek it going to other states, and the people of this state waiting for more data so that they know the long-term outcomes? Right now, it's only vaginoplasties that can happen in those that are 17. Phalloplasties have such high risk of a need for reintervention early on, it's almost 60%, that those aren't allowed by guidelines in those who are under 18. If you look to the handout that I gave you, this one here from the Mosaic Clinic in San Francisco, it speaks to the type of vaginoplasty that is done in minors. It's the part where I underlined, who can get a PPT vaginoplasty. This surgery can be a great option for patients whose other options are limited to including colon vaginoplasty. This includes patients needing revision surgery, a few others, and patients who have been on puberty blockers. Patients also can choose to have this type of vaginoplasty as their primary surgery if they understand and accept that there are no long-term data on the outcomes of this surgery. We ask the question, do we legislate the practice of medicine? In 2018, this legislature said yes when they banned conversion therapy for minors. There are no long-term data on PPT vaginoplasties, and that is the only realistic solution offered in this age group.
And Representative Leon, your time is up.
Thank you.
Any questions from committee members? Representative Weber, did you have a question?
I was just going to say that we do have a longstanding permission for the author of a particular amendment to be able to present it, so
Sure.
I have no objection to that happening.
Yeah, I mean, Representative Leon did waive that, and she did want to abide by the 3-minute rule. I did give you a little extra time because of the interruption earlier. But, you know, again, sure. Sure, absolutely.
Yeah.
Representative Mazur.
Thank you for taking my question. Can you tell me a little bit more about the second part of this bill?
Oh, yes, thank you. Thank you, Representative Mazur, and thank you, Mr. Chairman and Representative Weber. The second part of this bill is when this body decided to legislate the practice of medicine back in 2018. In 2017, a bill was introduced to prohibit what really is a barbaric practice, and it fell out of favor decades in the past. In the past, horrible things were done by people to try and make their sexuality conform, and that's simply not okay. At the time, there was the concern about how do we also make sure that this bill, this prohibition on certain medical practices in our law doesn't impact the transgender community. The way that was done is there was a line was added that said that, there was the one that said that that if you're undergoing gender transition, it's not conversion therapy. The problem is, we heard 2 years ago that this is limiting the practice of medicine. There are some providers who are afraid to come to New Hampshire and treat minors because they don't know what would be considered to be practices or treatments that seek to change their gender or gender identity. In the WorldPath guidelines, they actually define conversion therapy as attempts to compel a change in gender or a change in gender ideology. I believe that the words attempt to compel are far easier to understand, and one that a provider would be less afraid of inadvertently of having a memory from a patient than bring them to the licensing board. We also have the issue that the language that somebody pursuing a gender transition, is not inclusive to those who take a more meandering path or those whose ultimate destiny is a non-binary identity. Right now, the way that the language is written, if the licensing board were to take this on its face value, physicians who are following guidelines which say that healthcare professionals working with gender diverse adolescents should facilitate exploration and expression of gender openly and respectfully so that no particular gender identity is favored, that this could cause a problem. That's why I have brought some other language to better clarify this language. I want to make sure that everybody is treated with respect and that we aren't experimenting on our 17-year-olds. According to that clinic in San Francisco, there are no long-term data. We should pump the brakes, and we should also clarify that language, because if we have 3 more providers that are providing mental health care in New Hampshire, that means we're looking at maybe 600 more appointments for our youth. We're in a crisis among all youth, transgender youth and other youth. We need to make sure that those services are available. And I believe that by taking the hard task of actually trying to change this language, we'll be able to save lives. Thank you.
Thank you. Other questions? Yes, Representative Merchant.
Thank you, Mr. Chair, and thank you, Representative Leon, for taking my question. I noticed in the bill, if you go back and look at on page 3, lines 33 through 35, there's a reference to the insurance not being able to provide coverage for this. Can you help me understand that in the world of ERISA, which is a federal law, that most insurance companies today are self-funded and therefore come under ERISA? We cannot, as a state, supersede what the federal law says within ERISA. So, in essence, even though we're talking about trying to minimize the insurance coverage, in essence, we're talking about a very small percentage of the population at best, 15%, maybe 18%, that would be impacted. So, can you speak to that issue between the state law, which is what you're talking about, and ERISA, which is a federal law?
Thank you, Representative Merchant, for that question. When I brought this amendment, it was out of our work as a subcommittee to try and find those areas that we may be able to agree upon, which is on the genital surgery on minors and perhaps finding more respectful language on conversion therapy. The way that I did that was to take the existing section that dealt with the medical care and simply change it so that it wasn't for all gender conversion therapy, but to limit it to the genital gender reassignment surgeries. We can talk about those details about that specific language, but now that we actually have a proposal that may actually solve the needs of our state, I think that that's something for us to work through. If we did not have that section in there, would you be more supportive if we removed that section?
Follow up, Representative.
Thank you. Thank you for addressing the question. It does, to your point, it does not really get to the detail between federal law versus state law, which we cannot obviously exceed the federal law, or change the federal law through a state law. But back to the other question I have is this deals with the parent as well, and we talked about this earlier. Why are we talking about parents and parental rights on one side of the equation, but now we're talking about not giving the parents on the other side the same rights here? Because this is really coming down to having the parent, and if I understand the whole argument about parental rights, it's parents' rights supersede. Yet here, those rights don't. So explain to me why a parent on one side of the equation has all these rights, but now we're taking them away.
Thank you for the question. To the first point of this follow-up question, there are over half of the states that even in their Medicare programs and their Medicaid programs, they do not pay for these surgeries. So while there is a federal law, not all states are following that, but we can discuss that portion when we meet together as a subcommittee or a full committee in exec. To your second point, parental rights are limited at some points. A parent can't authorize their child to go use heroin and then mean that that is within rights. We know that heroin is dangerous and nobody would do that. But a parent also can't authorize their child to go suntanning in the state of New Hampshire because those under 18 cannot go to a tanning salon. Those under 18 can't get a driver's license without their parents paying for the state-sponsored or the state-endorsed driver's training. we need to look at the entire landscape. And it's not an issue of either we're entirely permissive and absolutely anything goes in a state of anarchy, or one in which the state is your actual parent. We need to look at that nuance and understand that most people don't realize that when you're 17 and if you've been on puberty blockers, your only option is a peritoneal vaginoplasty, one which the Mosaic Clinic in San Francisco appropriately says has no long-term data on outcomes. This is one of those areas where parents are looking to do the absolute best that they can for their kids. But they're not going to understand that detail and nuance to know that the PPT ones are very different than the ones that have been done for decades. The risks are much higher, and the durability, the need for revision is different. Look, I come from the world of orthopedics and all sorts of medical devices. With knees, you get 2 shots on goal. You wait as long as possible for your first knee replacement, because when that fails, you'll get a revision surgery that takes even more bone. After that revision surgery, you will be in a wheelchair, and that's just your knee. On the vaginoplasties, you can have a primary surgery and then a revision surgery, and then you're going into groundbreaking territory. By bumping the brakes and saying, wait a little longer, see about some data, and don't think that you're getting the same surgery that your older neighbor had, we can make sure that nobody is getting that knee at 25 or 17, and then suddenly when they have an infection, they have something else in need of revision, and then that has a problem later, they're left without options. I want to prioritize the health of 80-year-old transgenders just as much as 18, and I want those 18-year-olds to grow up and be healthy and live a long, good, productive, happy life with as few medical complications as possible. I think that drawing a line and stopping these PPT vaginoplasties will protect more and will increase everybody's health overall.
Thank you. Any other questions from committee members? Okay, seeing none, thank you very much, Representative Leon.
Thank you.
Also signed up to testify this morning is Courtney Reed. Or Courtney Preed. Is it Reed or Preed?
It's Reed, thank
Reed,
you.
okay,
Sorry, I
thank you.
just
No, that's okay.
getting
wanna make
my
sure
testimony for you.
I shouldn't criticize anybody's handwriting. Thank you.
Thank you so much.
You have about 3 minutes.
Thank you, Chair and Representative Leon, for considering my testimony. I wanted to speak to a few key considerations for opposing this amendment as representing the ACLU of New Hampshire, and largely speaking to that, like the original bill, unfortunately, the amendment remains as hostile legislation that unfairly targets and discriminates against transgender and gender nonconforming people in the Granite State. And that even though, as you'll hear and as allies in the LGBTQ advocacy community have heard from providers that gender affirming surgeries on minors are exceptionally rare, a total ban that overrides private medical decisions between doctors and their families is unnecessary and harmful. And it's reckless for legislators to deny vulnerable people care that their doctors may believe is medically necessary. And a threat to anyone element of gender affirming care leaves room for future attacks on age appropriate care for transgender youth. And gender affirming care is widely recognized as being the only evidence-based approach to addressing the healthcare needs of transgender adolescents, including severe mental health risks. And according to the American Medical Association, evidence that restricting access to gender affirming care can produce tragic effects on transgender persons disproportionately at risk of anxiety, stress, substance use disorder, and suicide. And I want to stress that the amendment singles out restrictions to healthcare for transgender youth and the prohibition of genital gender reassignment surgery, and that it This restriction only applies to transgender youth, however, not to minors with disorders of sex development. Despite that these procedures, as I stated, are exceedingly uncommon for youth to undergo, this language sends a message to that the healthcare needs of trans people are less valid than those of intersex individuals or individuals with sex developmental disorders. And there have been various appellate court decisions that have ruled against attempts to limit gender affirming care. In the Eighth Circuit in Brant v. Rutledge in Arkansas, a gender affirming care ban was overturned on grounds that it violated the 14th Amendment on the basis of discrimination, as well as in Williams v. Kincaid in the Fourth Circuit. And they also declared that gender affirming care is extended and that it's protected under the Americans with Disabilities Act for people experiencing gender dysphoria. And I also want to note that the language in the amendment surrounding insurance coverage for minors and for adults is in violation of New Hampshire's anti-discrimination laws as they've been applied to insurance. And you can see RSA 417.4, 8B, and RSA 420G6,
Your time
Roman
is up.
3C.
Could you wrap up, please?
Yeah, thank you. I'd be happy to send the rest of my comments to the committee later. Thank you so much.
Thank you very much. Questions from committee members? Representative, looked like you were about to ask a question. Questions? Representative Cushman.
Thank you, Mr. Chairman, and thank you for being here. Is gender dysphoria a medical disorder? Is that your understanding?
From my understanding, gender dysphoria has medically appropriate treatment that should be provided without interference from the state and according to the best judgment of physicians and their families.
Thank you.
Thank you so much for your question.
Other questions? Okay, I'm seeing none. Okay, you keep moving your microphone, Representative Shapiro. Do you have a question?
I do not have a question for the person testifying. I have a question for the chair.
Okay, all right, great. Thank you for your testimony.
Thank you, Representative.
Representative Shapiro?
You could see that I wanted to talk.
I-
I was just wondering if we could arrange the people testifying so that we hear people from Dartmouth Hitchcock, if they are here, to provide testimony earlier, because I think hearing from the people who actually provide medical services is foundational for all the other issues that we're going to discuss.
I have no objections to that. It's always, as I've said before, it's more of an art than a science in terms of arranging the cards. But no, you make a valid point, Representative Shapiro. Okay, I'd like to call Courtney Tanner from Dartmouth Health next to speak.
Good morning.
Good morning. You have 3 minutes.
Sure. For the record, Courtney Tanner. I serve as a Senior Director for Government Relations for Dartmouth Health. Dartmouth Health provides comprehensive quality care to patients across the state. As the state's only academic medical center, we're proud to provide specialty care to our patients that need complex care. Dartmouth Health has provided high-quality, gender-affirming care to both pediatric and adult patients. Our multidisciplinary clinic and program, both in Lebanon and the Southern clinics, is the only program in the state that supports pediatric and adult patients through gender transitions. We have multidisciplinary teams of doctors, nurses, social workers, and more, all of whom are highly skilled and trained, all of whom care deeply about their patients and their parents. Dartmouth Health has concerns about the amendment as introduced today. To Representative Weber's point, we have some concerns that this is very similar to the bill that we testified in opposition to last legislative session. But there are some differences to Representative Leon's point. The first section of this bill, or I should say the second, after the definition section, prohibits a physician from performing gender reassignment surgery on a patient 17 years or older. It also prohibits any physician or provider from referring a patient to gender reassignment surgery, for example, in Boston or another state. Providers, broadly, we at Dartmouth Health have a general rule that that surgery, gender affirming surgery, is not performed on minors. However, if you turn to the list of exceptions in the bill, I think the list of exceptions in and of themselves point to the fact that sometimes there are reasons to have medical necessity, reasons that there would be surgery. I would also note that broadly speaking, there's a principle here that we don't like to legislate medicine. These are complex subject matters that are really between a patient and a provider. I'm listening to the questions that are asked here today, and gosh, I certainly couldn't answer them. I'm not a provider. And these conversations really should be had between a provider and a patient in the physician's room. I also would like to note that Section 3 prohibits the use of public funds for transgender assignment resurgery, including Medicaid reimbursement. We really believe that this prohibition would further drive healthcare inequities. As stated, when there is a need to access this type of care, they are rare, but they're medically necessary. And so any barriers to necessary treatment, that is a health inequity. I'm happy to take questions. You'll see coming around, we are submitting written testimony on behalf of the health system. There's a list of providers that illustrate largely doctors, physicians, but nurses, social workers, psychologists that are in opposition of this legislation.
Thank you. Representative Shapiro.
Yes, thank you, Mr. Chair. I wonder if you could speak generally and specifically to people who who might be pursuing some kind of surgery. What part do parents or guardians play in the involvement with the care of someone 18 and younger? And what part do they play in actually consenting to any treatment for someone under 18?
Sure. So no matter what the type of care is, we always encourage, I'm listening to our chair of our Department of Pediatrics replaying in my head right now, and he always says that we encourage, if not champion, parental involvement in treatment plan development, no matter the type of care, whether this is GI care or gender affirming care. And further, it's the law that parents need to consent to treatment. So anyone under 18, parents or guardians need to consent to treatment.
Thank you.
Representative Nagel.
Thank you, Mr. Chairman. Mr. Chairman, thanks for taking my question.
Thanks for
I want to make sure I heard you correctly. It said, I think you said at some point during your testimony that you have a principle at Dartmouth that you don't do these kinds of surgeries in people in this age group.
Yes.
Did I hear that right?
That's our general policy, yes.
And how was that policy created?
That's a great question. I'll have to get back to you on that. But that is a general policy that we have as created clinically. But I would have to get back to you on the details of that. It's a great question.
And is it in writing or is it just either thing?
Well, there are clinical criteria that have to be met for any type of surgery, regardless of age. And so those are clinical decisions that are made within our department. I'll have to get back to you on whether or not this is in writing or not. I don't have a copy of it in front of me.
Another follow-up?
So if there was the decision that this type of surgery needed to be done in somebody that age group, would that patient be referred out of the institution?
It depends if we can provide that care or not. So sometimes we can provide that care for persons under 18, 17 or younger. However, it is a very rare exception. And I actually think the bill itself highlights a few areas in which that exception may be valid and may be medically necessary.
Representative Cushman and then Representative Merchant.
Thank you, Mr. Chairman. Thank you for being here, Ms. Tanner. Can you tell me what your medical specialty is?
I do not have a medical specialty. I'm an attorney by training, and I have a master's in social work.
Thank you. May I have a follow-up?
Follow-up.
Okay, so if we should be hearing from providers from Dartmouth Hitchcock for these technical questions, why was no one sent from Dartmouth?
So our providers are in clinic today, and they're unable to be here. That's why they have me.
Okay, and
One more, yeah.
it's my understanding that all medical facilities per New Hampshire statute have to have written and printed policies and procedures for their practice. So I'm assuming that Dartmouth has written guidelines on when this would be okay for anyone under 18 and when it would not, and what the guidelines are. Would you be able to get us those policies and
Yeah,
procedures?
as I stated to Representative Nagel, I'm happy to circle back on that, certainly.
Thank you.
Thank you. Representative Merchant.
Thank you, Mr. Chair. And thank you, Ms. Courtney, for taking the, Tanner for taking the question.
Courtney's fine.
In regards to following up on Representative Nagel's, the policy, it says here on your letter as well that the organization does not include gender affirming surgeries for transgender minors. Does it also exclude in the policy for a provider to make a referral? That's question one, if you will. And then number two, does Dartmouth Hitchcock know of any other policy you have that prohibits a provider from making any other kind of referral? So two questions. Do you have a policy specifically prohibiting a provider from making that referral? And do you have any other policies with any other prohibitions on referrals?
So I'm going to take those questions down as I circle back with other policies forthcoming. But I'll say that referrals are made only when medically necessary. So, yeah, I would just leave it at that.
Okay, Representative Mazur.
Thank you, Mr. Chair. Thank you for taking my question. So
course.
correct me if I'm wrong, but you said, what are those, you mentioned medical necessities. Is that medical necessities that warrant surgery, or what were medical necessities that warrant what?
Well, every patient is different, right? And every clinical case needs something different. And so it's really hard for me to answer a general question like that when every patient's going to need something different from their provider. And again, I think that really points to that these conversations have to be happening between a patient and a provider.
Did you have a follow-up, Representative?
Yeah. So just to clarify
Sure.
though, are you saying that if their medical necessities would warrant surgery at Dartmouth Hitchcock? Like when, and what, if so, what kind of medical necessities are those?
So again, I think that those conversations have to be happening between a provider and their patient. And
Is it a yes or no?
I guess I'm not understanding the question to be
Okay,
a yes or
so-
no question.
Yes. So is surgery done at Dartmouth Hitchcock in the case of a medical necessity?
It's our general rule that surgery is not performed on minors for gender affirming care. However, there are rare exceptions when they're medically necessary.
What are those exceptions?
That has to be decided on between a patient and a provider.
Would it be fair to say case by case?
Absolutely,
Can you-
absolutely.
As requested before, can you send us a list of those exceptions?
I will work on providing the written policy.
Thank you.
Representative Palmer.
So in that vein, one of the things that I'd also be concerned about is I don't know how you can make a list of every possible exception that needs to be made. And so, because even if you get all of the best surgeons, the best doctors, best providers of this kind of care, there's going to be the next case that shows up that doesn't fit that criteria.
Absolutely.
And so I guess my question is, would the physicians at Dartmouth be nervous about having just a specific list of exceptions? And if it's not on the list, what happens?
Yes, absolutely. And also that care is innovative, right? So I think, again, as I stated earlier, the list of exceptions in this bill alone illustrates that there are times where it's clinically appropriate. However, we know we move slow in this realm of the world, and so it's really dangerous to legislate medicine this way.
Other questions from committee members? Seeing none, thank you very much. Also signed up to speak is James Boynersbach, I believe it is, from the New Hampshire Psychological Association. Good morning. How did I do with that pronunciation? Was I close? Okay, I'm sorry.
Can you turn your microphone on?
Good morning to the committee chair and members of the committee.
And again, you have 3 minutes, sir.
My name is Dr. Jim Bommersbach. I am a licensed psychologist in New Hampshire and work as a forensic psychologist here. I moved to New Hampshire, and so I am one of those people who has started to build my life and find a place here in New Hampshire. And I represent the New Hampshire Psychological Association, which is a professional organization of over 200 psychologists active in practice in New Hampshire right now. And I am here today to speak on behalf of that organization in opposition to this amendment and this legislation. Specifically, the New Hampshire Psychological Association was an organization that was eager to contribute to the ban on conversion therapy in 2018 and to make sure that those practices would not be allowed in this state. It is unclear to me why the sponsors of this bill have alluded to some sort of conflation between gender affirming care, which is a category of services provided by medical providers who are licensed in the state and subject to the Board of Medicine, and conversion therapy, which is a unfounded, unscientific practice that seeks to impose the wills of parents and adults on minors. There is no similarity between these two practices, and so to conflate them in this bill as there appears to be an attempt to just does not make sense to me or the members of my organization who I represent. I'm a psychologist. I'm not a medical provider. I can speak to mental health issues that appear as a result of gender dysphoria, and that gender affirming care is a good solution for those individuals who are struggling with gender dysphoria. That this is an emerging area of care. I agree with the sponsors of the bill that is the case. However, that would then, in my mind, beg the question of why at this early stage are we choosing to ban this procedure, which is not the same thing as conversion therapy. There is no legitimate purpose for conversion therapy. There is no scientific evidence that it could work. That is not the case with gender affirming care or any of the things that may be falling under that umbrella. So I'm here basically to answer questions on the mental health front. If you guys have questions, I'm happy to try to address them.
Okay, thank you. Representative Shapiro.
Thank you, Mr. Chair. So when we heard testimony a year or two ago about another bill which was going to repeal the ban on conversion therapy, we heard some forceful testimony from a very limited number of clinicians who said that the statute as it now is, and I don't know if you're familiar with the actual wording of the statute as it currently reads, that the wording would discourage clinicians from talking to adolescents about sexuality, about their questions about sexuality, about their discomfort, so that it would discourage general discussion with youth, which I think we would all agree is really important. So from your practice or from your ideas representing the American Psychological Association, New Hampshire Psychological Association, would you think the current statute would discourage people from talking to adolescents about sexual concerns?
In my opinion, no. My organization is not aware of any individuals who have come to us and said that they have had board complaints or have had clients come to them with concerns about discussions general about sexual orientation or gender identity. In my understanding, there haven't been any board complaints in the 4 years based on this change to the legislation. And there's always going to be a small minority of providers who will be willing to allow their professional demeanor to be influenced by political attitudes. Part of the nice thing about working for an organization that represents hundreds of psychologists is that we get a wide variety of perspectives and opinions and histories. And again, our organization as a whole, we have people who come forward and say that we are supporting this ban as it is currently written. We came forth in 2020 to maintain our support for that bill, and we continue our support for that consistent ban on conversion therapy.
Thank you.
Other questions? Representative Cushman.
Thank you, Mr. Chairman. Thank you for taking my question. So is it necessary for us to legislate the practice of around psychology? Wouldn't conversion therapy already be, against the principles and the ethics guidelines and the administrative rules for psychologists in New Hampshire without the language that's currently in law?
It's a very good question. Part of the difficulty with conversion therapy and the necessity for a ban for it was that it was often not something that was advertised or publicly offered, but something that was done through less open means. So you had providers who had unclear certifications, who had facilities that may or may not be within good standing in terms of their ability to provide care for people. And so there was less clarity about who was going to be providing this practice and whether or not they would be accountable to a board. So in this case, a ban was a reasonable effort to try to make sure that no one can provide these services, whether or not they are licensed. And that contrasts with gender affirming care, which is uniformly practiced by people who have medical licenses. And so, again, I don't see the comparison between the two.
Follow up.
Okay, thank you. And I'm just wondering, I lost my train of thought. I apologize. Can't.
Any other questions? Representative Mazur.
Thank you. Thank you for taking my question. So do you think guidance counselors in schools are able to appropriately counsel children who are experiencing gender dysphoria?
I would say yes and no. It would depend on the case. There are certainly going to be individuals who would need a low level of care. I mean, the vast majority of folks who experience some questions about their gender identity are going to be sort of just questioning, having a low level of interest or curiosity. For those folks who need more intensive care, they're likely going to need a higher level of services, and it would depend on the qualifications of the guidance counselor in that school to recognize whether or not they have the qualifications and training appropriate to offer those services, or to refer that to a more trained and specialized provider.
Yeah.
You have a follow-up?
Yeah. Yep. Yes. So do you receive a lot of referrals from guidance counselors in schools for that then?
My organization represents psychologists,
Yep.
and I am not acting as a clinical psychologist in my own practice. As I said at the beginning, I am a forensic psychologist working with the criminal justice system. I can tell you that my colleagues who I've spoken with have not reported a large number of referrals coming from guidance counselors.
Okay.
But I can follow up with my colleagues and see if there have been more referrals that they haven't discussed with me personally.
Representative Weber and then Representative Cushman.
Thank you. I think I've thought better of my question. I think it's been answered. Thank you very much.
Representative Cushman.
Thank you, Mr. Chairman. So going back to, thank you. It's hard to do both at once. I'm playing clerk and trying to.
For which I'm very grateful, by the way.
So thanks for your patience.
Mhm.
I'm wondering, going back to, you were discussing that there would be those fly-by-night operations that are engaging in conversion therapy. Are those kinds of operations violating licensing laws at that point if they're practicing psychology but they're not licensed?
Again, it would depend on the circumstances of that individual operation. Um, there have been situations I believe I'm aware of where they have employed people who have had some sort of medical license or who have had a affiliated health license. But again, I'm speaking based on my own reading of newspaper stories and at this point. So I can't speak to any specific one of these operations. I've only been aware from testimonials, people who have been who have lived experiences when they've talked about their experiences there, talking about the operators of these facilities not necessarily having the appropriate licensure.
Representative Missouri.
Thank you again. So is this association you represent in support of gender reassignment surgery for minors?
When it is medically indicated and there has been discussion between the minor, if they have a parent or guardian present, to have the parent and guardian part of the conversation, to have medical providers as part of the conversation, then yes, generally we are supportive of individuals who are seeking medical care, that they are able to access that medical care.
Thank you.
Other questions from committee members? I'm seeing none. Seeing none? Okay, thank you.
Thank you very much.
Also signed up to speak is Sam Hawkins from NAMI of New Hampshire. Again, sir, you have about 3 minutes.
Good morning.
Good morning.
Thank you for the opportunity to testify today. My name is Sam Hawkins. I'm the Public Policy Assistant at NAMI New Hampshire, the National Alliance on Mental Illness. NAMI New Hampshire is a nonprofit grassroots organization whose mission is to improve the lives of all people impacted by mental illness and suicide through support, education, and advocacy. On behalf of NAMI New Hampshire, I'm here today to speak in opposition to both Amendment 2023-2359 and HB 619 itself. I'll keep my comments simple, as we've heard from a lot of professionals, and I think we have more in the bank.
And again, sir, the focus of this hearing is on the amendment itself.
Yes, of course. NAMI New Hampshire believes that all people should be treated with respect and dignity and should have access to mental and physical health care free from interference. As a result of stigma and discrimination, LGBTQ+ individuals, especially those who are transgender or gender nonconforming, are often at an elevated risk for experiencing anxiety and depression. However, NAMI New Hampshire recognizes that with access to affirming healthcare and support within their homes and communities, this risk can be avoided. Simply put, gender-affirming care works. It saves lives and enhances the well-being of those who need it. Therefore, we oppose any harmful policies targeting LGBTQ+ individuals, such as the limit on gender-affirming care in Section 1 of this amendment. We also remain firm in our opposition of the harmful practice of conversion therapy and oppose any policies that may enable its use. In our opinion, Section 2 of this amendment would soften the statutory definition of conversion therapy, increasing the risk of this practice being used against LGBTQ+ individuals when they seek affirming mental health care. For those reasons, I ask you to please oppose Amendment 2023-2359. Thank you.
Okay, thank you. Questions from committee members? Representative Cushman.
Thank you for recognizing me and thank you for taking my question. I understand that there is a common understanding that transgender youth are at higher risk of suicide ideation, and that the brunt of that research comes from the Trevor Project. Is that your understanding also?
Thank you for your question. We have received a lot of, or read a lot of research from the Trevor Project. I'm not sure that I would indicate that they're the primary source, but I'm not the expert on all of that research.
Okay, thank you.
Other questions? Okay, I'm seeing none. Okay,
Thank
thank
you.
you. Also signed up to speak is Representative Alicia Leas from Hudson, Hillsborough County, District 38.
Thank you.
Good morning, Representative. Again, you have 3 minutes. Welcome.
I just, I appreciate what you're doing here. I think it's a really good job. I want to say that to begin with. I just wanted to talk about make a couple points. One is, I like your definition, the fact that you defined gender and sex, because while we can change our gender, we can't change our sex because it's written into every single one of the cells in our system. And one thing I wanted to point out, you're talking about surgery, but I did want to point out that hormones, which are often done in conjunction with all of this, if you have hormones of the opposite sex, they are toxic to your system. And while we as legislators shouldn't be mandating what people can and can't, adults can and can't do, it is our it is, I think, our duty to at least help protect people from malpractice. And there is nothing in here, but I would like to see something, if it's possible, that says if somebody's going to be doing that, they have to state and get signed an understanding of the patient of all of the risks, whether it's the surgery or whether it's the hormones and other things that go with it, because I think I have met a number of people who have gone through this and they were not informed of all of the potential risks. And I think that's very important. And then the other part, I wanted to talk about the counseling, and I am thrilled to see that you are making it specific, that general counseling that is not compelling is allowed, because I have spoken to counselors who felt that they were not allowed to do any type of counseling to people with gender dysphoria because of the law, the way it was written. And a number of people, if not the majority of people who have gender dysphoria, have underlying issues, be it trauma or other things, that it's very important that they get proper counseling for. And I have spoken again to various people who have transitioned who did not get that counseling because the counselors were afraid that that would be disobeying the law the way it's written now. So I really appreciate that you've opened that up, and I hope you will continue to support that so that people can get the counseling that they need, particularly exploring what the underlying issues may be that they have. Thank you.
Thank you. Questions from committee members? I see no questions. Thank you.
Thank you very much.
Also signed up to speak is Lynn Courier-Stanley from the National Association of Social Workers, the New Hampshire chapter. Good morning.
Good morning.
Again, you have 3 minutes.
Thank you, Mr. Chairman, and members of the committee for hearing my testimony. For the record, my name is Lynn Courier-Stanley. I'm a licensed independent clinical social worker, and I'm the executive director of the National Association of Social Workers, New Hampshire chapter, representing 850 members in the state of New Hampshire. I'm primarily going to focus on the conversion therapy piece, but recognizing, Representative Cushman, you said something about the Trevor Project and people who, transgender youth, queer and questioning youth having higher rates of depression. It's not intrinsic within the person who is questioning their gender, questioning their sexuality to be depressed. It is more an outcropping of the way society treats people who are questioning or transgender. As far as the conversion therapy, and that's a misname, there's nothing therapeutic about this practice. It is dangerous, it is harmful, it is hurtful. And years ago when we got this banned, I at first wondered whether or not it was a solution looking for a problem until I heard the testimony of hundreds of people who had been affected, and then also hearing from social workers and psychologists and other mental health professionals saying, yes, I've had to treat people who had been victims of this practice. It is fine the way it is written. There were a few people when they tried to overturn the ban who were confused about what conversion therapy might be. It is about, if it's not within your scope of practice to do that work, to work with people who are questioning their sexuality or gender identity, then they need to refer them to somebody who it is within their scope of practice. Please leave the conversion therapy ban alone. It is fine. I'll sum up my testimony, and I'm happy to answer any questions.
Thank you. Questions from committee members? Representative Merchant.
Thank you, Mr. Chair, and thank you for taking the question. During your testimony, you referred to the external environment, which is basically the society, versus the internal one, which is the individual. In saying that, is there any documentation or studies out there in societies that are more accepting of this practice and that impact it has on depression? What I'm trying to get to is that, are there countries that are more accepting, therefore the individual has less depression than we would find here in the United States?
I think thank you for the question, and I'm happy to find that research. I think we can extrapolate from what we're seeing right now with some states that are, the don't say gay bills or banning gender affirming care outright. The numbers of suicide attempts and the number of suicides has jumped dramatically. I can't say that this is a causal relationship, but it sure sounds like a very strong correlation, and I'm sure that the research will start to meet it out in the next few years.
Other questions? Representative Missouri?
Thank you. Thank you for taking my question. Could you please send us those stats that you just said? It sounded a little bit like conjecture to me, but if you have exact stats that say these suicides are a result of this, I would love to see
Yeah,
that.
that's why I said I'm not saying that there's a
So it's conjecture.
causation.
It's
Well,
conjecture.
it's a very strong correlation that 988
Thank you.
and the other suicide projects are reporting on.
Representative Cushman.
Thank you, Mr. Chairman. So I'm wondering, are you aware that the World Path, it's the World Practice on Thank you. You're familiar with what WPATH
I'm
is.
sorry, I'm not hearing what you're.
Can you say again what it is?
WPATH, the World Professional Association of Transitional Health.
Okay.
WPATH.
Thank you. Are you familiar with that organization?
Not to speak
Okay.
on them.
Follow
Follow up.
up. Well, they define conversion therapy as attempts to compel a gender diverse child through words, actions, or both to identify with or behave in accordance with the gender associated with the sex assigned at birth. Do you agree that that's a solid and appropriate definition for conversion therapy?
That's their definition of conversion therapy. What I'm saying is that conversion therapy is unethical for any medical or behavioral health professional. In New Hampshire, all of the other New England states, New York, New Jersey, and go out a little further, it's now also illegal. It is a practice that looks different depending on where you are, and I don't think we need to go further than what we already have in our ban on conversion therapy.
Follow up.
Okay. but you see where that's problematic, where we deal with law and we need solid definitions. How can we prohibit something if we can't define it?
But I think we did define it in the original law.
Any other questions from committee members? Seeing none? Okay, thank you very much.
Thank you.
Also signed up to speak is Chris Urkel from GLAD. Good morning.
Good morning. Thank you, Chair. Thank you,
You're
members of the committee.
Good, you have 3 minutes.
My name's Chris Urchel. I am with GLAD in Boston, but I'm a New Hampshire licensed attorney. I also have extensive experience litigating in the area of access to healthcare for transgender people, including transgender minors. I'm going to rush through a few points because 3 minutes isn't long to cover all this material. As we've heard, it is exceedingly rare that anyone under the age of 18 ever has the kind of surgeries that are prohibited in this bill. And in fact, I do have anecdotal information about those extremely rare cases if people want to hear. But I do want to point out that between 2016 and 2020, only 405 surgeries of the type defined in here were performed on people 18 years old and younger. And that includes 18-year-olds. The majority of those people were 18-year-olds. So we are talking about a very, very small number of surgeries. And the only place where I know anywhere near here is Boston Children's Hospital, where a surgery like that has ever taken place. And it is very rare even there. And I can talk more about that if people have questions about it. I just want to add, though, that in those circumstances in which it's medically indicated, it is very, very important for those people to have access to the health care that they need. It's not for any reason other than medical necessity that a 17-year-old would ever go through a procedure like that. And again, I'm happy to talk more if people have questions about it. When it comes to the prohibition on insurance coverage, I just want to point out that it is pretty unusual for the legislature to prohibit private insurance companies from providing benefits to people of any kind. That's a very, very rare to see in any kind of legislation, and it kind of raises my eyebrows that there's an effort, prohibiting certain practices is one thing, but then making a law that would prohibit a private insurance company from providing health benefits to an individual is a step that goes a little bit beyond. There's another part of this bill that would insulate insurance companies that didn't want to provide coverage for gender transition related medical care. And I just want to point out that conflicts not only with several New Hampshire statutes, as we've already heard, it also conflicts with the New Hampshire Division of Insurance's stated policy, and it conflicts with Section 1557 of the Affordable Care Act, which prohibits discrimination on the basis of transgender status in health benefits. Perhaps most alarming about this bill is the proposed amendments to the ban on conversion therapy. As we've heard, professionals in mental health care professionals do not have trouble complying with the ban on conversion therapy. It is not confusing to them. I would look with a lot of suspicion on any mental health care provider who stated otherwise. I do want to point out that many states besides New Hampshire, including states in New England and beyond, use exactly the same language. All you have to do is a Google search, practices or treatments that seek to change an individual's sexual orientation or gender identity. It's very well understood.
If you could please start wrapping up.
Yeah. I'm concerned that a lot of the points in the conversion therapy amendments reflect a fundamental misunderstanding of gender identity, with all due respect to the drafters. And I'm happy to address any of the issues that I just raised in more detail. So please feel free to ask questions. Thank you.
Questions from committee members. Representative Weber.
Thank you, and thank you for taking my question. Thank you for being here today. I would indeed be very interested in hearing more elaboration on the issue of the conversion therapy language.
Yeah, thank you. So I really appreciate that question. So A person's gender identity is not something that can be changed. It is fixed from a very young age. That's what experts in the field have told us. And so what the bill suggests is that counselors can transition or detransition somebody according to their wishes. And the whole point of the ban on conversion therapy is to make it clear that that is not possible. What can change and what does change is a person's understanding of their gender identity. That changes over time. That is where a mental health provider can come in and provide invaluable support to someone who's seeking to understand their gender identity. The word detransition shows up in the amendment, which is just, it's not a term of art. It's not a term that mental health care professionals will use to describe anything. Gender transition is a process that sometimes takes many turns, and because understanding a person's gender identity can be really difficult for a number of reasons that I could go into for hours, talking about why it's so hard for some young people especially to understand their gender identity. So the fact that the word detransition shows up in here, the fact that we're talking about how a provider can provide counseling that changes a person's gender identity, this is not possible. A person's gender identity is fixed, and a mental health care provider can provide invaluable support in helping a person understand that. And that can involve helping a person with social transition, helping a person work through issues related to medical transition, and more. But a person's gender identity cannot be changed. And I just want to make sure that's absolutely clear. But that's not what the language of Part C suggests.
Follow up?
It's actually not a follow-up, it's a whole new question, if I may.
Sure.
The other thing you touched on but did not go into deeply is the issue of people who have actually had the surgery at a younger age and the necessity, which I think you characterized as a very deep necessity, medical necessity. And I wish if you could explain those needs a little bit more, that would be helpful.
Sure. I'm actually pretty familiar with a specific court case, which, because the case is impounded, because it involves a minor, I don't want to go into too much detail describing it to uncover private information about people and their intimate details of their lives. But there was a 17-year-old who needed surgery, and I just want to say the hospital where the surgery was performed, they would not perform it without a court order. So they asked the family to file a lawsuit in court seeking a judgment declaring that the hospital must perform or has the legal right to perform this surgery. And in this particular anecdotal circumstance that I can share with you, there are some really important characteristic things that I've heard in other cases too. First, that the person, it was a transgender girl, because as Rep. Leon has noted, it's only vaginoplasty that's performed on anyone who's 17 years old. She was a transgender girl who had been out living as a girl from a very, very young age. Okay. She was on her way to college and experiencing severe gender dysphoria due to the fact that her body did not conform to her gender identity. She was about to go to college, and she had one opportunity where she could be in the care of her mother and father in their home while recovering from a very serious surgery, before going off and going to college, where she was going to then be, in front of her peers and in front of everybody else without the protection. And so she needed to be secure in who she was and in her body before she went to college. It's a very rare circumstance that somebody is in this situation of need. But if you knew the girl, if you knew the circumstances, you would understand completely why it was medically necessary in that specific case. But again, very rare that it's ever medically indicated.
Representative Merchant.
Thank you, Mr. Chair, and also thank you for taking the question. During the testimony, what I think I heard, was between the years of 2016 and 2020, there were 45 such surgeries done.
405, but yeah.
105?
405.
405. And you talked about that was including 18 and 17. What would be interesting, do we have any data about how many of those were 17 and in the state of New Hampshire?
I can tell you that I wish that there were the data splitting out how many were 18 and 17. What I believe is that the study that where I got this information, which I can provide to the committee later, what I intuit is that they needed a number of a sample size that was large enough to perform any kind of analysis. So they needed to include 18-year-olds. They couldn't just look at 17-year-olds, right? So I don't have that breakdown, unfortunately, and I wish I knew who did, right? But how many people who are residents of the state of New Hampshire and had that surgery in New Hampshire? I think the answer is 0. And then I think if you were to ask how many people who are residents of the state of New Hampshire and had the surgery elsewhere, it is probably close to 0, but not 0.
Follow up.
So the ones that don't qualify for 0, were they done, again, back to, it sounds like there's one hospital in New England here, Boston Children's Hospital. Is it their policy that in order for them to perform the surgery, they require a court order?
In that one particular case, they did. And I actually don't know if that happened to be the first time that ever happened or not for that hospital, but presuming it was in 2019,
Thank you.
Representative Mazur and then Representative Weber.
Yes, thank you for taking my question. Are you familiar, have you read the WPATH standard of care, and are you familiar with WPATH?
I'm very familiar with WPATH. I haven't read everything in all the standards of care. They're pretty expansive, so yeah.
Okay, thank you. I have another
Follow up.
So is a detransitioner someone who detransitions, do they continue to experience gender dysphoria?
I would tend to use the term someone who desists from, and then I would say either desists from social transition or desists from taking hormones or something along those lines. I wouldn't use the term detransition if I were talking professionally because I don't think it's a professional term. But yeah,
Okay,
that's
they
my
call
understanding.
themselves that, but okay.
Well, I mean, I think you'll find some people who do, and some people who say I desisted from treatment and or I desisted from social transition. Right.
So
One more
quick,
follow-up.
yep. Would the surgery then be considered necessary or successful in those situations?
Can you please clarify the question?
So if a person who has transitioned, has gotten surgery and then decides to detransition, was that surgery considered as a success?
I mean, I think the question is, does that individual regret the surgery, right? And yeah, there are rare instances in which people have gender transition related surgeries and regret them, and that's really unfortunate. And in fact, medical standards of care must be established in such a way to minimize the level of regret. I will note that compared to other surgical interventions, regret rates for gender transition surgeries are lower, and of course, as everyone should have the right to exercise, exercise their rights against any medical professional who does not comply with the standards of care when providing treatment. And that's why we have really robust medical malpractice standards and laws in New Hampshire and everywhere in the country.
Representative Weber.
Thank you. My question was actually just a follow-up with respect to the 405 surgeries between 2016 and 2020. I'm not sure I wrote down what the geographical area those were in.
That was the United States. I apologize if I didn't.
That was
mention
the whole United States.
Yes,
Okay,
the whole
thank you
United
very
States
much.
for those years, those 5 years.
And
A follow up.
just a quick follow-up. Would you believe that I very much regret having parted with my uvula to treat sleep apnea?
I would believe it. Thank you.
Would you further believe that I was informed that it might not help and I chose to do it anyway? Thank you.
I would believe that, yes.
Other questions? Representative Cannon.
We've talked a bit about detransitioning. Are you aware of any numbers associated with people that have detransitioned who have transitioned back?
Oh, I do know that. I mean, I know anecdotally of situations in which that happened. Sometimes someone will transition to living socially as another gender. And I just want to point out, while we're talking about detransition or desisting, that there is a number of reasons that a person might detransition. It might include regret. It might include it might include, a person coming to terms with understanding that their gender dysphoria wasn't telling them what they thought it was telling them. And it might involve somebody who said the social pressures that come along with living as a different gender are actually much, much greater than I was prepared for, either because my personal transition story didn't allow me to assimilate as well as I thought I could, or because I just experienced so much discrimination. I hear a number of stories from all aspects, including regret, but I just want to point out that it's a really wide range. And yes, sometimes people on their journey of understanding their gender identity might transition and then might detransition or transition back and then might transition back again. And then sometimes people will discover that they have a non-binary gender identity, but they weren't necessarily open to that possibility at an earlier age. There's so many different paths that a person might take, and I think it's really important to ensure that everybody has the right and ability and all the tools that they need to help find out how to live as comfortably as they can in their gender identity.
Other questions? Representative Missouri?
Thank you again. Yeah, so when someone wants to detransition, do you know what the billing codes for that standard of care would be?
Again, the medical treatment wouldn't be considered detransition. It would be considered transition-related care. It would be considered gender transition-related care for somebody to either desist taking hormones or for somebody to have other surgical treatments or anything else.
So is that a fact or opinion? Because I have heard the opposite, that there are billing codes for transitioning. And so would you agree that in another state next door to us, there would not be billing codes for those who choose to detransition?
Well, are you talking about surgical treatments specifically?
All of it.
All of it. Okay, so billing codes associated with the specific hormone. I mean, okay, I'm not an insurance expert, but I think that we're talking about some really, really complicated stuff here. When a person who is prescribed hormone therapy, the billing code, I think, is associated with the medication, not with a diagnosis or what it's intended to treat, right? And I think that's true generally for surgical treatments as well. But there are certainly going to be instances in which a surgical treatment will be associated only with gender transition. So I just think that it's like a really complicated question that's beyond the scope of this amendment for sure.
Representative Cushman?
Thank you, Mr. Chairman. Thank you for being here and taking my question.
Mhm.
I think the crux of the issue that Representative Missouri was trying to get to is that it's difficult to track. A lot of times, people who no longer want to continue on their path to transition to the different gender that they were born end up ghosting the clinic that they used to go to and just get off the hormones on their own. Oftentimes, there's no follow-up care and there's no post-care surveillance. And so we have a couple of studies. We've got like 11 studies to date that show that if children aren't affirmed and there's watchful waiting, that the vast majority, the gender dysphoria resolves. And then we have other studies. The most recent large one published in 2021 followed 139 boys from 7 to 21 years old and showed that as adults, 87% outgrew their gender dysphoria. So we don't have the stats on regret, but we do have the stats on, outgrowing the dysphoria to an extent. But do you see the problem with the billing codes? Do you see how that could lend to it seeming like there's a lot less detransitioning than is pervade?
May I suggest that if this committee and this legislature are concerned with the availability of competent care for people who wish to desist from gender transition, that that legislation be enacted to improve the healthcare options available to those individuals. I think that would be a fantastic use of this legislature's resources and time.
Follow up.
Well, wouldn't it be effective to also pass this legislation and then prevent those horrible regret cases from occurring in the first place?
If you're suggesting that it was better to prevent people from getting healthcare that they need because there might be a small percentage of the people who get it who end up regretting the healthcare that they need, then I would disagree with you.
Let's move on. Any other questions for this person? Seeing no other questions, thank you.
Thank you so much. Oh,
Sorry, Representative Shapiro?
My pen?
Your badge is under.
He dropped his badge under the
Oh,
desk.
okay.
Thank you.
I can see it. That's why they make them orange. They're easy to find.
Yeah.
He also signed up to speak is Beth Scar, Scaer. Just indicates themselves. Good morning.
Hi, Beth Scar from Nashua.
And again, you have 3 minutes. Thank you.
I'm here to ask you to vote ought to pass on this amendment to HB 619. I have met and heard the stories from many detransitioners, the vast majority who are girls, who have deep regret for the irreversible damage to their bodies. Girls who are confused about their gender, and many who also have comorbid serious mental health problems such as autism, ADHD, and PTSD are being led down the path of medical transition, starting with puberty blockers, followed by cross-sex hormones, and finally having their healthy body parts removed. With girls, this means most often means radical double mastectomies, leaving large painful scars and taking away the sexual function of the breasts and the ability to breastfeed their babies. The pain from the scars and from phantom breast syndrome can be lifelong. These girls don't have a grasp on what they are giving up and what physical problems they are taking on. There's no reason to rush these procedures when these girls have so much at stake and can make a decision for surgery later in life when they have the life experience and the brain development to make these decisions. This amendment would not only protect children from lifelong regret, it would also protect medical providers who risk being the target of lawsuits. Numerous lawsuits have been brought by detransitioners against their medical providers for medically transitioning them when they were underage. The most famous of these detransitioners is Chloe Cole, who is suing Kaiser Permanente in California. You may have heard of her tragic story of having a double mastectomy at 15 and beginning the process of detransitioning at 18. She says, my teenage life has been the culmination of excruciating pain, regret, and most importantly, injustice. I have been emotionally and physically damaged and stunted by so-called medical professionals in my most important developmental period. I was butchered by an institution that we trust more than anything else in our lives. What is worse is that I am not alone in my pain. I will see to the fact that the blood and tears of detransitioners like myself will not lay waste. It is impossible for me to recoup what I have lost, but I will ensure no children will be harmed at the hands of these liars and mutilators. New Hampshire medical professionals are at risk of these lawsuits if they remove the healthy body parts of gender-confused children. Please vote ought to pass on this amendment and protect kids from irreversible damage to their bodies and lifelong regret, and New Hampshire medical professionals from lawsuits. Thank you.
Thank you. Questions from committee members? Representative Cushman.
Thank you, Mr. Chairman. Thank you for being here. Are you familiar with the lawsuit filed by Isabella Ayala in Rhode Island recently?
Yeah.
Are you able to tell us a little bit about that? From what I read, she's not only suing the clinicians who led her and supported her in her gender transition experience, but also the American Academy of Pediatrics for fraud for their guidelines that were issued in 2018, and the studies that that are cited as supporting those guidelines as being fraudulent and not proving what they say to prove.
Excuse me, Representative Navarro, do you have a point of order?
I believe I do. I thought we could ask questions of a testimony, not introduce completely new testimony, which if Representative Cushman wanted to present testimony, maybe she should fill out a card and get in line.
She was talking about lawsuits, so I wanted to ask her.
Seemed a little far-fetched to me, but I just,
Yeah,
I'm not debating I'm just the appropriateness of
My
such a
interpretation
long-winded
was she was
question.
just trying to find out if the witness was aware of this and what, if she might have additional information. Is that correct, Representative Cushman?
yes, the one of the practitioners that is being sued is Jason Rafferty, who wrote those guidelines for the AAP, and soon after those were published, James Cantor wrote a huge takedown of it, pointing out how the supposed data was fraudulent. There was no, there was no scientific evidence for what they were saying, and now he was one of the doctors treating Isabella, and so he's getting sued. The AAP is getting sued, and I don't see how the gender medical complex can go forward with this, the way they're treating kids fraudulently.
Representative Shapiro?
Thank you, Mr. Chair. I may have this wrong, but I believe in the beginning of your testimony, you talked about having met a lot of people who are detransitioning. And I'm wondering in what context, either professionally or are these, how have you met these people?
Well, Chloe Cole, well, first of all, Katie Anderson lives, well, she doesn't live in New Hampshire, but she works and goes to church here in New Hampshire, and she's been doing a lot of speaking around the state. We saw her last night in Goffstown. And then Chloe Cole was here in April. And Prisha Mosley visited shortly after that. And of course, I've been reading their stories and watching their video testimony.
Follow-up?
So then it would be accurate to say that these are people who have been speaking publicly and you've heard and followed, rather than perhaps working as a social worker who has a lot of people coming to see you who've had this problem, or being a parent and having a lot of your kids' friends who are having this problem. That you, when you say you've met a lot of people, these are people who are speaking out and nationally.
Well, I also do a lot of reading of the D-Trans subreddit, where people go on there privately. They don't want to reveal their identity, and they're terribly afraid to reveal their identities, and they talk about the horrible regret. And a lot of them, these procedures happening when they're children, and they say over and over again, I didn't know. Of course they didn't know, they're kids.
Thank you very much.
Thank you.
Other questions from committee members? See none. Thank you very much.
Thanks.
Also signed up to speak is Ava Hawks from the New Hampshire Medical Society.
I had to check to see if it's still morning. So good morning. Thank you for having me and allowing me to testify. Dear Chairman McDonald and members of the Health, Human Services, and Elderly Affairs Committee, my name is Ava Hawks, and I'm the Director of Advocacy for the New Hampshire Medical Society. The New Hampshire Medical Society strongly opposes House Bill 619, as well as the Replace All Non-Germane Amendment 2359H being proposed today. The New Hampshire Medical Society's mission is to advocate for the well-being of our patients, for our profession, and for the betterment of public health. The physicians of the Granite State, our members, honor this mission every day by centering patient care around health equity and inclusivity, combating discriminatory policies and legislative initiatives that make our state unsafe to marginalized groups such as LGBTQ+ youth. Our state's physicians who provide gender-affirming care, GAC, know that such health care is well-researched, medically necessary, and safe. These providers are also aware of the data surrounding the harmful and more devastatingly life-threatening outcomes for our gender-diverse youth when policies such as what is set forth in Amendment 2359H an outright prohibition of GAC in the form of genital gender reassignment surgery for minors, dangerously conflating GAC with conversion therapy, and encouraging insurers to restrict coverage for GAC surgeries are implemented. In December of 2022, the Trevor Project released a detailed analysis of nearly 34,000 LGBT youth ages 13 to 24 across the 50 states. This survey reported that 39% of LGBTQ youth in New Hampshire had seriously considered suicide in the past year, while about 10% had attempted suicide. Furthermore, the physicians of the Live Free or Die state also oppose government overreach into provider-patient relationships. Amendment 2359H and the underlying bill seeks to disrupt and dissuade providers from providing evidence-based health care to gender-diverse youth with parental/guardian consultation, free from discrimination and the further marginalization of such vulnerable populations. For these reasons, the New Hampshire Medical Society strongly encourages the Health, Human Services, and Elderly Affairs Committee to vote down Amendment 2359H and vote House Bill 619 inexpedient to legislate. Thank you for your time and consideration of my testimony, and I'm happy to take any questions back to the experts that are the physicians.
Thank you. Any questions from committee members? Oh, Representative Cushman.
Thank you, Mr. Chairman. I'm specifically wondering, can you speak to the long-term data on the peritoneal pull-through vaginoplasties?
I thank you for the question, Representative. I am flattered that you thought I could answer that question, but I know a number of physicians who have submitted written testimony that are members who provide this care in New Hampshire, then I'm sure I'm happy to take that question back to them and get a clear answer for you. I would hate to inaccurately represent that.
Could I add 2 questions to that?
Sure.
For them to get to us.
Yeah.
Are
You
these?
may want to give her a chance to write down the
yeah.
first one.
Yeah. Could you repeat the first one?
So
just so I can-
specifically, what's the long-term data look like on the peritoneal pull-through vaginoplasties? Those are the ones that are required to take colonic tissue, essentially, in cases where, say, there are a couple of reasons why, but puberty blockers would be one. There's not enough penile tissue to use.
Okay.
And then the other is that safe and effective based on that data? And then just the last one would be, how many of these surgeries are performed on children in New Hampshire each year? Any gender reassignment surgeries, not specifically the peritoneal pull-through, but we should have that delineated, as well as phalloplasties.
Okay.
Thank you.
You're welcome. Thank you.
Other questions from committee members? Representative Mazur?
Yes, thank you. Yeah, so the statement in here says, similar to what Representative Cushman just said, but just to clarify, so our state's physicians who provide gender affirming care, does that include gender reassignment surgery?
That's a great question. So I know you all should have received written testimony via the virtual sign-in from Dr. Frances Lim Liberty, who works with Dartmouth. And I believe Courtney Tanner, who represents Dartmouth, spoke on the testimony that you folks received. And I believe that question is covered in her testimony.
Unfortunately, there were no providers represented here today, so we were not able to get that information. They will be sending it along, but we still haven't heard that today.
Okay. I'm happy to bring that question back to the surface.
Thank you.
You're welcome.
Representative Weber?
But just to be clear, my understanding is that you're saying that that testimony has already been uploaded to our general court website.
Correct.
Thank you.
Representative Merchant?
Thank you, Mr. Chair. Could you repeat the physician that did the upload on that testimony?
So I believe it's going to be I think it was a letter with multiple signees, but Dr. Frances Lim Liberty of Dartmouth.
Thank you.
Yeah.
Other questions? Seeing no other questions, thank you very much.
Thank you.
Oh, I'm sorry, Representative Palmer.
It's not really a question. It's just that we had heard earlier that there have been 0 surgeries in juveniles in New Hampshire. And I did check with contacted Dartmouth yesterday, and they don't perform any under 18 bottom surgeries. And actually, they don't do any transgender surgeries under the age of 18. That doesn't
Okay.
cover all of New Hampshire, but that's Dartmouth.
Thank you. Thank you.
Thanks.
Also signed up to speak this morning is Paula Minahan from the New Hampshire Hospital Association.
Good
Good morning.
morning, Mr.
Again.
Chairman, members of the committee.
Give them 3 minutes.
My name is Paula Minahan, Senior Vice President, State Government Relations for the New Hampshire Hospital Association, representing all our hospitals, both community and specialty hospitals. So the Hospital Association is opposed to House Bill 619 as introduced, as well as the non-germane amendment number 2023-2359H, which would amend RSA 332 to prohibit gender surgery on minors and prohibit conversion therapy on minors. The New Hampshire Hospital Association supports policies which advance health equity and inclusion for all individuals. House Bill 619's non-germane amendment is contrary to these principles of health equity and inclusion and would be discriminatory towards an often marginalized group in our society. In addition, the non-germane amendment is an overreach by effectively attempting to legislate the practice of medicine. This is a precedent that should be avoided. Furthermore, prohibiting all public and private insurers from being required to provide coverage for gender-affirming health care further discriminates against this often marginalized segment of our society. We also believe this amendment would conflict, as Ms. Reed from the ACLU identified, it conflicts with current health insurance non-discriminatory statutes, as well as other non-discriminatory state statutes. We strongly urge you to find this non-germane amendment and the underlying bill as an expedient to legislate, and thank you for the opportunity to provide these comments.
Thank you. Questions from committee members? Representative Merchant.
Thank you, Mr. Chair, and thank you, Ms. Minahan, for taking the question. In regards to the insurance, earlier I asked about the issue of ERISA and whether state law has any impact on the benefits that one can provide under the ERISA plans. I know you're not in insurance per se, but you sort of alluded to it as far as in your testimony. Would there be somebody in the hospital association or somewhere that we could get that kind of information back to us?
Thank you, Representative, for the question. While I don't represent insurers, I did work for one for a number of years. ERISA, as you indicated, does not fall under state statute, so there's no ability. Those statutes that are cited in the amendment would not cover ERISA plans, just like they won't cover Medicare or they won't cover Medicare Advantage either.
Other questions from committee members? Seeing none. Thank you very much.
Thank you.
Also signed up to speak is Kate West, who's representing herself. Okay. Okay. All right. I'll keep it down. I'll move it down in the pack then. Also signed up to speak is Kim Peasley, who's also representing herself. Good morning, and you have 3 minutes.
There we go. Before I get to my prepared testimony, I just want to take issue with the level of condescension earlier, that parents will be unable to grasp the nuances of this type of care, and by implication that licensed medical providers would also require input from this body. As the
Ma'am,
only,
I'm going to have to, you have 3 minutes total, so.
excuse me?
You have 3 minutes for your testimony.
Thanks for making me pause. Because this body is the only one capable of grasping this topic. I'm a PhD chemist and I'm also an attorney. Facts matter to me, and politics have no place in the provision of medical care. As a legislator in New Hampshire, you swore to faithfully and impartially discharge and perform all your duties incumbent on you as a state representative. Impartiality requires at least a modicum of research on the relevant subject prior to proposing any law to abridge a citizen's right.
Over 1.3 million doctors recognize the medical necessity of transition-related care for improving the physical and mental health of transgender people, especially young people. As a parent of a transgender son, it's bills like this that encourage the daily, systematic attacks on his safety and on his mere existence. Your actions have very real consequences, and you purposely are inflicting harm on children of New Hampshire, the group that you claim to care so much about. HB 619 is born out of willful ignorance of the facts and is
Point
a
of order.
blatant attempt.
Yes, point of order. Sorry, we don't apply motive here. You said that we're deliberately inflicting harm.
Can you at least give me the courtesy of letting me speak? We've listened to
We
you.
will, ma'am. We just want to clarify, nobody is trying to harm anybody. We may disagree on issues.
Well,
but-
I would take issue with that. You know, requiring people to prove their worthiness for medical care
Yeah, well,
to
we
your
don't- we
standards
wanna-
is not
We don't want to
okay.
debate, ma'am. Just finish your testimony, please.
While my child has not required these treatments, there's no need to ban it for those who do. Despite multiple doctorate degrees, my biggest accomplishment to date has been keeping my son alive. I just think the fact that you sit here and you think you know what's best for people you've never met is disgraceful. And your input is unwanted, uninformed, and dangerous. This is inexpedient to legislate. Thank you.
Thank you. Also signed up to speak is Michelle Foisey, who is also representing herself. Hopefully I pronounced the name right. I'm not sure I did, but
Michelle Foisey, yes.
okay, great. You have 3 minutes.
Thank you, Chair and members of the committee, for listening to our testimonies today. My name is Michelle Foisey, and I live in Temple, New Hampshire. I'm a mother of 6 and also a physical therapist. The last 3 years of my full-time job has been being a mom to my 4 youngest. At first, staying home was due to the pandemic. Now it's for a different reason. My 16-year-old child has been struggling with many physical and mental health issues over the past 3 years. This past year, they transitioned to homeschooling due to their severe migraines. Unfortunately, we didn't realize at the time just how severe our child's depression was, or that they were also experiencing gender dysphoria. In March, for the first time in my presence, they expressed they were experiencing near constant suicidal thoughts while at a physician visit. Immediately, I sought counseling for them. After beginning therapy, they were slowly able to talk more openly to us about things. In September, they came to me and asked if they were too old to start hormone therapy. After that conversation, a huge weight lifted from our child's mind. We now have seen an endocrinologist and are beginning the process of starting hormone replacement therapy to allow our child to have a more feminine body they feel at home in. My queer child has started their own journey, and I'm here to support them however I can. Witnessing the self-isolation and severe depression my child has endured has been horrific and painful as their mother. A heartache I hope few parents have to cope with. We are incredibly fortunate to continue to have our child here with us today after their attempted suicide. Recently, I sat in a doctor's office while at their side as they revealed details of that attempt. Their attempt was before they came to me about HRT, before they were able to express how lost they were feeling in their own body. Now there is finally light creeping through the darkness they have been living in. As their mom, I am able to feel hope again for their future. I am grateful every day that their beautiful face is still here for me to touch. I know for certain that they would not be if it wasn't for the gender-affirming care that they will soon receive. If you were to ask my teenager today if they hope to have gender-affirming surgery, they will say, I don't know. If they come to me next year and they say they need surgery, I will support them until they are able to find the care they require for their survival. It is not the place of the legislature to determine when a referral is medically necessary for essential health care and block insurance coverage for that care. Gender-affirming care is always medically necessary and is life-saving at every age. As a mother and a medical professional, I know how to advocate for my children. I ask questions, I listen, and I trust. I trust in both the practitioners providing care for my family, and I trust in my children's words. If my child is unable to live in a body that is not the one that they were biologically given at 16 years old, I cannot comprehend how that suddenly becomes a legal right at 18. Most importantly, I cannot fathom how it is expected that their mental health would support them to live through such struggle to reach 18. Many transgender kids die by suicide due to gender dysphoria they experience and the extreme mental anguish they struggle through every day. As a mother, I support the essential medical care that can be life-saving for teens like mine. Please vote ITL for HB 619.
Thank you. Are you taking questions or?
If anyone has any questions,
Representative Shapiro.
Thank you, Mr. Chair. I just want to thank you for sharing what's obviously a very personal and at times very painful experience. And I hope that it's more hopeful now. It seems like it is. Thank you.
thank you very much.
Other questions? I see none. Thank you very much.
Thank you.
Also signed up to speak is Elijah Swanson, representing themselves. Good morning, and again, you have 3 minutes.
Thank you. I'm actually reading his testimony for him. His brother got deployed to Iraq, and
Okay, are you Kate McCarty?
yes.
Oh, okay, all right.
Okay.
Great.
Thank you. So again, these are Elijah's words. Let me be very clear. There is absolutely nothing wrong or unnatural about being transgender. As a transgender man myself, I grappled with the feelings of internalized transphobia and shame for most of my life. Now that I have been able to access gender-affirming care, I have been able to live a much happier, healthier life. There are a lot of misconceptions and misinformation surrounding gender-affirming care, especially when it comes to care for minors. Minors rarely receive any surgery, and those receiving surgery are 16 or 17, not young children. Let me frame it this way. The age of consent in the state of New Hampshire is 16 years of age. A 16-year-old can legally get pregnant and bear a child. Why do we trust the cisgender heterosexual teenager to go through pregnancy, a permanent medical decision, and raise a child, but not the transgender teenager who feels so dysphoric and uncomfortable in their own skin that they need to undergo the process to receive gender-affirming care? Now, let me also be very clear that no teenager in New Hampshire is able to readily get gender-affirming genital surgeries. There is therapy, reference letters, and long wait times involved. Despite all of this, trans people still go through the process to receive care. Why? Because gender-affirming care is life-saving and necessary. I survived 4 suicide attempts before I turned 18 years old. This committee has been told time and time again the statistics on suicide in trans youth. HB 619 is unnecessary and flies in the face of all the major medical organizations that have already stated that gender-affirming care is medically necessary. The American College of Physicians, among other leading medical organizations, has condemned efforts to criminalize gender-affirming care and other evidence-based care as interference with the physician-patient relationship. Receiving gender-affirming care is the only evidence-based approach to address gender dysphoria in transgender teenagers. Parental rights are also often mentioned in the discourse around gender-affirming care. I have a quote from a parent who I know is supportive of their trans child. Bans on gender-affirming care infringe on my right to take care of my child in the way that makes sense to me and is supported by scientific evidence. Why are my rights as a supportive parent given less weight than those who wish to not support their trans kid? Decisions on gender-affirming care should be left to the patient, their doctor, and their parents. I do not know every single transgender minor in the state of New Hampshire, so I cannot speak on whether the fact they should or should not receive gender-affirming care. This committee does not know every single transgender minor in the state of New Hampshire, so important medical decisions like receiving gender-affirming care should be left to those who understand the individual situation the most, the patient, doctor, and their parents. I ask this committee to vote inexpedient to legislate all forms on House Bill 619. Thank you.
Thank you. You're speaking for someone else. Are you prepared to take any questions, or are you just issuing the testimony?
It depends on the question. I can't speak for him, but...
Sure. Are there any questions? Representative Weber.
Thank you, and I think I will unravel that particular question. Did I understand you to say at the beginning of, before you read the testimony, that Elijah is currently deployed overseas?
No, his brother just got called up.
His brother, I see.
Yes,
So
and he
he's
didn't wanna
supporting
miss
his
the
brother.
chance to- yes.
Okay.
Yep.
Thank you very much.
Okay, thank you.
And we wish his brother well and thank him for
I'll
his
let him know.
service.
Thank you.
Other questions? Seeing none. Thank you very much.
Thank you.
Also signed up to speak is Lynn's Jackows, 603 Equality.
They just stepped out.
Just wait a minute. Oh, there we go. Good morning.
Good morning.
And again, 3 minutes.
My name is Lynn Stakehouse. I use they, them pronouns. I live in Dover. I'm a non binary trans person, and I am strongly opposed to the current bill and the amendment, and urge committee members to vote ITL on either. As someone who has been active with supporting the transgender community in New Hampshire since 2017, I would just want to state that there's no form of HB 619 that is acceptable. Gender affirming healthcare is medically necessary healthcare, and all of it, from puberty blockers to hormones to surgeries, is deemed safe by every major medical organization. I am someone who hopes to be a parent in the next couple of years, and if a child were to be a trans daughter and she were to tell me that she needed puberty blockers, hormones, even surgery at, under the age of 18, which would only be likely to happen at 17, I would do absolutely everything in my power to support her, including seeking a referral out of state if we were not able to find and care in New Hampshire. And I would be extremely upset if insurance was not able to cover it. I think it's unprecedented to try to block insurance from covering these procedures. In 2018, I attended the hearings that ultimately removed the exclusion on Medicaid covering gender affirming and care. And the last step of that committee, or last step of that process, was the Joint Legislative Committee on Administrative Rules. Was really deeming that the exclusion needed to be removed to bring New Hampshire into compliance with the Affordable Care Act, and to not be open up for any lawsuits. So I'm not a lawyer, but my understanding is that reversing that decision for Medicaid would open up New Hampshire to lawsuits. And I have never seen any kind of legislation that would seek to block private insurance from covering any kind of care. Again, this as care only happens in a very small number of transgender girls who have started the transition process early. I only know of one anecdotal evidence of one trans girl getting the surgery out of state. Not sure if it's the same person that Attorney Chris Urschel referred to or not, but that's the only anecdotal evidence that I know of one person getting that right before college. And these decisions are always made between a doctor, parents, and the minor involved after much discussion and other steps, including in hormones prior to that. And it's not up for this body to ban any sort of medical care. You all are not or medical professionals or experts on this type of care. We should trust doctors to do this as case by case where it is necessary to relieve of dysphoria. And
Your time is up.
sure, I'm happy to take any questions.
Okay, thank you. Any questions from committee members? I see none. Thank you very much. Also signed up to speak is Eleanor McDonough, representing herself. Good morning.
Good morning, or good afternoon.
Oh, I'm sorry. Got to keep up with the times, literally.
Good afternoon, Mr. Chairman, members of the committee. Thank you for the opportunity to speak. My name is Eleanor McDonough. I live in Exeter, and I'm opposed to HB 619 and as amended. New Hampshire is a state that values personal freedom for its citizens, and this legislation is a significant blow to the medical freedoms that we hold dear. This discriminatory bill is government overreach at its worst and would set a terrifying precedent that the government knows better than parents on how to raise their kids, putting the state in between parents, teens, and their doctors. Comparisons on gender-affirming care with use of tanning booths and heroin are not appropriate examples, as those are not medical procedures that are approved by the major professional medical organizations in our country. When legislating against personal medical rights, any infringement is not only dangerous, it's a slippery slope. It is not the role of government to decide if care, which is widely acknowledged as the best treatment for gender dysphoria, is medically necessary. As a trans woman, I know from my own personal experience that gender-affirming care is essential, life-saving health care. Among trans youth, desistance and detransition rates are incredibly low. The most recent study this year in the prestigious journal Pediatrics showed that 97.5% of trans youth continue to identify as trans on a 5-year follow-up. The sample size was also larger than all previous sample sizes of this population, 317 trans youth. Trans kids are insistent, persistent, and consistent about who they are, and the nationwide trend of legislating against their existence is not only disturbing, it is having a negative impact on their mental health. It's time for these performative attacks on them in state legislatures to stop. It's also time to stop using the time of this important body on unnecessary regulations and instead focus on the real issues that Granite Staters care about, like access to housing, education, quality jobs, and our environment. New Hampshire should continue to be a place where all families feel free to raise their children without fear. Please vote ITL on this bill and this amendment. Thank you.
Thank you. Any questions? Seeing none, thank you.
Thank you, Mr. Chairman.
Also signed up to speak is Bill Bloom. Good morning. Good afternoon.
Good afternoon, everyone. Long time no see. Hope everyone's been well. My name is Bill Blum. I'm from Portsmouth, New Hampshire. I am also non-binary, and I use they, them pronouns. Here to highlight a couple of things. I won't repeat what's been said because I think the point's been made. I did not write testimony today. I've come from lived experience, and one thing that stood out to me in the beginning was the last 5 words of the Pledge of Allegiance, that we all looked at that flag over there and recited them. If you do not remember what they are, it's liberty and justice for all. This proposed legislation and amendment is a exclusive practice. It is not inclusive to all people. It is excluding an already marginalized community that I am a part of. I am visible and present for the invisible. Our community in of itself is protective, it's secretive. And that's because people are afraid to either share their story publicly or they're afraid to live authentically because of something. The home might not be safe, or the families, or there's other reasons that I can keep going on about, but I won't. What I will say is the medical professionals have already testified. I come from a place where data drives decisions. I'm not an expert in being a doctor, and I am not an expert. I do have lived experience as being a transgendered, non-binary individual, so I can speak to that. However, I feel that none of you have sat in a doctor's office as a physician or someone who's providing care to someone who actually needs gender-affirming care. So I find it difficult to hear about how personal opinions will get in the way of medical decisions. I see that this proposed legislation will harm and continue to harm our community. When the similar legislation came up earlier this year, the day that it was shut down, a teen actually did commit suicide within our community, jumped off the bridge of 293. So this is real. We are here. We are seen. There was talk earlier about 405 surgeries were performed over the last 5 years. Easy math, let's call that 100 a year. None of them were in New Hampshire. So we're here to talk about New Hampshire. The other thing we're going to talk about is the detransitioners. I've lived in this community for a long time, secretively and now publicly. I've never met one from New Hampshire. So if they would like to send me a message, I'd love to chat with them. My information's public. And again, I will close now with, it's Halloween, people. It's my favorite holiday. Please be kind to the people who show up to your door, including the boy in the dress or the girl in the Superman costume. We are all people and we will all be seen today
Right.
as well as tomorrow.
Thank you.
You're welcome.
Any questions? Seeing none. Thank you.
You're welcome.
Also signed up to speak is Nancy Biederman. Again, you indicate you'd like 3 to 5 minutes. Please keep it to 3.
Oh, yes, thank you. Hi, Nancy Biederman. Good afternoon. We all started in the morning. I'm speaking, going to tell you a story about a 32-year-old woman who in 1969 had experienced 5 miscarriages and went to her doctor and said, I would like to have a child. This woman was my mother-in-law, and she was given a drug called DES, which is a artificial synthetic, non-steroidal estrogen and endocrine disruptor. This drug was sold to patients and doctors to prevent spontaneous abortions, despite the lack of proven efficacy. They had no proof this would work. Her doctor said, let's give this one shot. She took the drug, and she did have a successful pregnancy. But we now know from history that those shots and that drug did nothing to make that pregnancy happen. What it did do is create multi-generational problems for any person born after having their mother take that drug. We have DES children who are born with abnormalities, cancer. They have a higher risk of cancer than anyone else. And we are now seeing that the grandchildren are having effects from this drug. My mother-in-law, thankfully, in some aspects, does not know that the drug she took will be affecting her 2 grandchildren. She passed away at the age of 59. She was diagnosed at 53 with a very rare type of uterine cancer. And at that point, there was nobody made the connection that it was from this drug that she took to have a pregnancy stayed. I'm talking about this drug because it did finally get banned in 1970, 1 year after she took it. It took until 1980 for it to get banned in Europe. And it still, even after that, was still being given, not to humans, but to animals. And so it ended up into the food supply. Finally, in the year 2000, the year that her first grandchild was born, it was finally designated as a carcinogen. As far as her grandchildren right now, we do know from studies that there are neurodevelopmental issues, which both my children suffer from. I will not ever share with my children that they are suffering this because of a choice their grandmother made, an uninformed decision.
Your time is up. If you could wrap up, please.
I just want to say that every service industry, and that's what the medical society is, a service industry, needs to be regulated. And they don't know all the answers, but we do have proof from Europe that the drugs and the surgeries don't work. And I suggest that we pass this bill. Thank you.
Thank you. Questions from committee members? Representative Cushman.
Thank you, Mr. Chairman, and thank you for sharing that story with us. When you say that they don't work, are you seeing the same studies that are showing that that mental health and suicide ideation is higher after transition care or gender affirming care starts, hormones, puberty blockers, or is it something else?
I'm saying that giving the hormones and the blockers too, they are causing more physical damage. They have studies done where the bones are breaking of young children that were given blockers or any hormone. We're, in my opinion, we're playing with Mother Nature. And when we start introducing artificial things into the body, there are consequences, and maybe unintended consequences, but there are consequences to changing what nature and God has already provided for us.
Other questions? Seeing no other questions, thank you very much.
Thank you.
Also signed up to speak is Jennifer Smith.
Good afternoon. Thank you for taking my testimony. I am a transgender woman, and I am also a retired medical physician. I also, while I can't represent PFLAG New Hampshire, have been very active with PFLAG New Hampshire and know multiple, not also through personal connections, multiple parents of transgender girls. And I think that's the germane thing in this first section. I'm not going to speak to the second section. I think the mental health providers have spoken quite well to it. But the fact that there is currently no provider in New Hampshire providing the gender affirming surgery, genital surgery, because I point out that this amendment, I've already spoken against the underlying bill last spring, that the testimony about breast reduction surgery or removal is non-germane to this non-germane amendment, because this is about genital surgery. And I want to just echo what has already been said about the emotional impact if you interfere, because you've selected 18 solely because that's after 18, the legal age at which this person can now make their own decisions. And the fact is, I know multiple parents whose children have, in this more modern era, been able to talk to their parents early on about their gender dysphoria and get the appropriate care. And I have yet to hear, as was indicated before, of any one of those people regretting, with parental support and other support, transitioning. And if you say to a 16 or 17-year-old, great, you're going to graduate and you're going to get to go out and do this, that, and the other, and they have no chance of feeling comfortable in their own body as an adult because they didn't get a chance to have that surgery, and you're threatening to criminalize even referring them across state lines for this, then you really are having a huge impact on that family. And I would beg you not to go down that path. I mean, I also would say, as a medical provider, you have no business doing this kind of thing about something you really don't understand. And you're not criminalizing other surgeries being provided because, oh my gosh, we haven't had adequate follow-up studies. Well, that has happened on quite a few things. And I think as medical providers, we've gotten a lot better since the DES story. And by the way, that DES story from then, those providers were going against their own medical professional societies that had already said, well before that, don't give DES.
Your time is up, if you can
Thank
please
you.
wrap up.
So I'm happy to answer any questions.
Okay, thank you. Representative Weber.
Thank you. Thank you for taking my question and welcome back.
Thank you.
I'm interested in this exploration from a medical provider's perspective of having to weigh the risks of a bad outcome, and virtually every medical procedure that I've ever undergone, I have been told that there were risks of a bad outcome. and I chose whether to have the procedure or not based on that. Am I not, could you speak generally to the risks on the one side of a bad outcome of a procedure or a treatment as applied to minors with gender dysphoria versus the risk of leaving them without the treatment that is needed?
Yeah, I think that's unfortunately so individual that it requires good studies by non-biased individuals. And I think a lot of things that have been cited about worse outcomes after gender treatment are really kind of trying to find people who are unhappy still. And there's lots of reasons to still be unhappy. It can be very hard to make this work. Believe me, I didn't try to make it publicly work until I'd retired. And I had already been on cross-sex hormones for a couple of decades. It's just, this is tough stuff. And by the way, cross-sex hormones are not toxic. That's a mischaracterization. They are not toxic. So.
Other questions?
Thank you.
Any other questions? Seeing none. Thank you. Also signed up to speak is Kate West. Good afternoon.
Good afternoon. Thank you for the opportunity to speak. My name is Kate West. I live right here in Concord. I'm here to speak in opposition to HB 619 and this amendment. Every person has the right to make medical decisions for themselves and their children with the guidance of their chosen medical professional. No person or group should have that right threatened or revoked. As representatives, it is imperative that you trust the people you represent to make decisions about their own bodies and for their own families. As was stated, there are always risks and there are always rewards to proposed medical treatment, and it is up to the patients and their medical professionals to decide the path that is best for each individual. As was also stated, these situations are very nuanced, and there are so many variables that come with these situations for each individual patient that you simply, as a governing body, do not have the time to sit in a room with each individual case and make that case-by-case decision with them. That is best left to their medical professionals and themselves. So each person is best equipped to know what is healthy and necessary for them and their family. They're best equipped when given the information to make decisions based on their own health and what they know is the best path forward for them. I believe that this proposed amendment and legislation is taking away the rights of people to make their own choices for themselves. So please recommend to the full committee to vote ITL on this bill and amendment. Thank you.
Thank you. Any questions from committee members? Seeing none. Thank you. And the final person who has signed up to speak today is Robert Tangway. Is Robert Tangway here? Apparently not. I have no one else signed up. Does anyone else wish to testify on this amendment? Seeing none, I am going to close this public hearing on this amendment to House Bill 619, specifically Amendment 2023-2359H. Thank you all for being here, and we stand adjourned.